Hi there, Dr. Kwame here of Elevate Medical Clinic, and joining me is Mr. Victor Francis of Fortress Fitness Lifestyle Magazine, here for our health segment, our weekly segment that is.
Welcome again, as Doc said, to another weekly segment of health and wellness. And this segment is brought to you by I Am Water, the hidden messages that is hidden in the bottle. So you drink with a purpose, right? So Doc, what are we going to discuss today?
Well, today, before our official topic, I would just like to introduce a few of the services because a lot of persons inquired about services available at Elevate Medical Clinic. So Elevate Medical Clinic, while it is a GP clinic, so for your common coughs, colds, general medicals, it is also a facility where many different treatment options are provided. So while we look at chronic disease management, high blood pressure, high blood sugar, labs, also you can get your weight loss treatments here, weight loss management, medically guided. Aesthetic services are also available, such as body enhancements. So for that, ladies, especially for that stubborn stomach fat, we help to provide safe, non-invasive options to actually help you to actually lose that. That is also applicable to the arms, the thighs, in addition to the back, which is a common issue in women. In addition to that, we also provide various platelet-rich plasma or PRP options. So that can be done for the face to rejuvenate the skin, also apply to various pain treatments and as well. So those are some of the things that are available. Not to mention the intimate rejuvenation, both for men and women. So that is where we help you to perform at your best, right? And that is something that is also available here. So Elevate Medical Clinic is a place where you can access not just your medical needs, but your aesthetic and wellness concerns as well.
Right, so you're here, there's a lot, right? And it's one-stop people. You come here, you do anything, men, you're having problems in whatever area, come by doctor here, right? Ladies, and especially coming up now, whereby you see this come for carnival, where everybody going to jump just now in the weight management, exercise, whatever, and we know a lot of people just want to get it, especially midsection and your arms and your back, as you said. Stubborn areas, as Doc call it, right? So come down here, did medical, and Doc will help you with that. And you can always come by me after. Let's do some stuff wrong, to just stay by Doc, because this Doc just helping you get it in order. But to keep it, you come by me and do some exercise and do some, with some diet and things like that, right? So Doc, with all these services that you provide there. Today, which one are we going to talk about, or what topic are we talking about today?
So today we're going to touch on arthritis, and today we're just going to highlight arthritis, which is a common complaint, especially in the older population, the elderly. However, a lot of athletes, a lot of persons who are into health and fitness, and who lead active lifestyles can also, complain of symptoms like that.
So Doc, today now, what are we going to talk about?
Okay, well, today we're going to touch on arthritis, which is a common complaint, especially in the elderly population, and more so in the younger population, particularly those who are physically active and in the gym or playing sports, athletes, things of that nature.
So arthritis, the word arthritis, I mean, when I heard the word arthritis in my head, is pain in your knee, your joints, your elbow, your hand, but what really is arthritis?
Right, so arthritis in simple terms is a form of joint inflammation. So as a result of inflammation, you will get pain. You might experience swelling, tenderness, pain on walking, right? And there are different types of arthritis. So for example, I had a patient with me today, and she's in her 60s, previously very active, but came in for a platelet-rich plasma or a PRP consult to see how we could relieve her arthritis. So she has osteoarthritis, which is a wear and tear disease. So it's the same as wear and tear in the vehicle. So this is where that wear and tear and overuse can sometimes break down the cartilage in the joint and cause pain, right?
Well, the difference with the vehicle is that you can change that part and wear.
The pain,
financial pain.
Financial pain.
But in your body, I mean, how do we deal with, how do one deal with arthritis?
Well, it depends on the type of arthritis.
Right.
So osteoarthritis is the wear and tear. You can think of it as if you just need to replace parts, right? Now, if caught early, treatments such as which we offer here as platelet-rich plasma, which is where we use your own body's natural ability to heal and repair the joint, giving you reduced need for surgery or knee replacement in the future, enhanced quality of life, reduced pain, increased mobility. That's applied there. Osteoarthritis is where you can have that inflammation. Some people treat it with pain management by like to tell patients better to restore the joint, have a stronger joint for the future, and you're able to increase your quality of life. Versus rheumatoid arthritis, which is actually an autoimmune disease where the body attacks the joint. So common distinguishing features are important to recognize, so you could get an idea of what the two are.
So if you start to get pain somewhere down in your age, as you get older, the first things that come by yourself and to find out which one it is that you have, so you can treat it a particular way. But the question I would ask is that, you know, when you do arthritis, you just think about, you know, aging,
Yeah.
right? Do people in their 20s, 30s suffer with those kind of stuff as well?
Of course, even children
Oh,
can get arthritis.
okay.
So there's a form of arthritis known as juvenile arthritis. You find
Oh.
very small children suffer with it. So it's a spectrum of disease. However, I am finding that a lot of younger persons are in the clinic for platelet-rich plasma treatment. Why we ask them to start early is because that is going to help to stabilize that joint, rebuild a stronger joint, minimizing the risk or minimizing the need for surgery or knee replacement later on. But it can also be applied to the hip and the shoulder. So those are common areas of overuse. Now you will be wondering, okay, how are we seeing more patients in the younger age group with arthritis? Now that's due to weight as well. So increased weight or your body carrying a lot of weight, remember the knees are responsible for capturing and really maintaining that weight bearing capacity. And a lot of times the obese patients will have a faster onset of arthritis because the joint is under more strain.
Yeah, so it means now, so it always good to, like, as you know, you're checking your health and your health provider
Yeah.
to always manage your weight
Weight management is key.
is a factor.
Exactly.
And how important is nutrition in all of this with this particular
It's
arthritis?
extremely important because, for example, you would have diabetics having a hard time managing joint pain. You would have persons with high cholesterol, immunocompromised, really being subject to more severe disease because they already have a comorbidity or another medical condition. Your nutrition is actually key because there are certain foods that can aggravate inflammation, it can aggravate or increase the acid content. That is also a form of arthritis, gouty arthritis. So those are things that are at play. So this is why a consultation in depth is really important to assess your particular needs and see which treatment option is best for you.
Okay, because you know, growing up, yeah, but arthritis, you know, is more, you know, like your grandparents, something like
Yeah,
that.
not anymore.
Yeah, and you know, it always appears, seems to me that, you know, like that's when I get it, you know, you have to die with it. You know?
No,
Yeah.
that is not the case.
Yeah.
For example, I have a gentleman, a patient of mine in his late 60s, and he was previously an avid sport player, particularly basketball, football, and he came to me, his joint was swollen, it was wear and tear, so I knew for sure his chances of having osteoarthritis were higher because he spent a lot of his life in sport. And we spoke, had a consultation, and I just asked him to trust the process. And in the consultation, we go very in depth into your treatment and what to expect. And now he's back out playing basketball. He's playing against men in their 20s.
Serious?
And beating them on the court. And
Alright,
back to
that's
his
nice
favorite
though.
activity.
That's nice
So
though. That's good.
It's
That's
not
good.
just about pain management. It's about, going back to that quality of life you can really enjoy.
Yeah, because you know,
Yeah.
seeing elderly back then, you know, with always rubbing,
Yeah,
you know,
always rubbing.
yeah, I think
We can actively treat it now.
Yeah, well, right. Times has changed, right?
Yeah.
Because that's why I mentioned earlier on. I felt back then, like, you know, is when I get that, that's it. You just have
Yeah,
to
correct.
buy a Bengay and, you know,
No.
move on.
No.
But now there's, you know, there's treatment.
Correct.
And there's treatment right here at Elevate Medical.
At Elevate Medical. And you come in, you don't need a hospital stay, you don't need an entire day downtime. You come in, you can have your procedure done same day, and you're in and out.
But that's good, right? So folks, it's not just one particular service here, and I know some of you all suffer with a lot of people actually suffer with arthritis and pain. And other than the arthritis, and even if you're injured in the sense of if you're a gymmer like me or any other sport, to just be careful, but just to be sure what it is always good to come in
Yes.
to get assessed, to find out which arthritis, even if it's arthritis, which one it is. You want to treat the right thing. So you just want to come in and you know, so you want to, so just go over the counter in the drugstore
You need to
and
come
say, you know
and
what,
check.
give me a Bengay, I have an injury. Come and check, you know, because, you know, later you stay, I guess it'll be worse for you.
Yeah, because osteoarthritis doesn't just magically disappear.
Okay.
It is, in most cases, it tends to worsen over time because the more injury, simple walking, but remember, the weight bearing that your joint will need to do versus someone who's almost 300 pounds is very different. So let's just say that person is having pain, but they don't treat the area. It can just progress over time and get worse. So this is why sometimes our patients in their 40s looking to need knee replacement because when they were in their early 30s or late 20s, they did not understand or it wasn't explained to them that a treatment option is available they could explore.
Well, you know, you saying that, my ran an ex-co-worker who retired some years now, and back then he played a lot of football. We used to play a lot of football, and he always have this right knee band. And I was saying, bad knee. You know, recently he had to do a knee replacement.
Yeah.
So that is a good example for me to really understand what you're saying is that not being taken care of, but down the road you have to do a drastic surgery
Correct.
that may or may not even, you know, help you could be at a later stage in your life
Correct.
to really combat this operation. So again, early detection, I think,
Is key.
based on what you're saying, is the key. So again, younger people in the 20s, and your 30s, don't feel when you hit with arthritis, you're like, I'm young.
You just leave it.
You just leave it. You know, other aches, come to check it out because it's something that could progress based on what the doc's saying. It's something that could progress down the road and it will be more therapy you had to do for a longer period of time because it will be in an advanced stage, right?
Exactly.
And one of the things I also want to mention now, ask you, doc, I mean, apart from the arthritis, I know it ties in, right? And everything is about common access yourself. I know you deal with pain management and things like that, right? And I know a lot of people, including myself, right, have elbow pain, right? They call it tennis elbow, right? Can you just talk on that a little bit?
Yeah, those are options that are available for patients with tennis elbow. You know, there are various different areas that are affected in that region, especially if you're lifting weights. That is also very common. However, the treatment options vary. That varies from anti-inflammatories, both natural and also oral pain medication. However, it can be done locally where agents are applied into the elbow or the area to help to minimize pain and to help to restore proper function to the area. So it's all about just getting a consultation in and really exploring what the options are because it will vary depending on your particular medical needs as well.
Yeah, and those procedures, just like the arthritis, is pretty safe.
Yeah, pretty safe. You come in, once we have a consultation, you come in, you have it, and then you leave. Yeah, usually you'll be at home, you don't need any downtime, you will need sick leave, so those things are pretty well tolerated.
Because we men, when you hear the word doctor, what has happened is like, we don't say, we are the provider, we are the body and hustle,
you have to take care of yourself.
To all ban it up a little bit, and you know what?
Take care of yourself.
All right, so part of the message is, viewers, men and women, we have to take care of ourselves, which is something that I say a lot on my platform. Health first. Health first, because without your knee, you can't go to your job. Without your knee, you can run around with your grandchildren, your kids, or things like that, and it affects, a better way of living down the road. So again, the arthritis topic today is something I'm really glad that we touch on because I know a lot of people actually who, have that arthritis, and now there's a place close to where they live because it's in this area as well.
That
they can come and check it out, right? So
let's get you up, running, active, not missing out on anything because of any.
Right, so but it's important. It's really important topic, and we take for granted. And I know people as well when it's rainy season, and I put it myself, watch the arthritis is kicking.
Yeah, come on. That should be a thing on the past.
It should be a thing on the past. Yes, just what that name is, a thing on the past.
Yeah, it should be a thing on the past.
Right, so everybody who's suffering from pain in your joints, and you call it arthritis, whatever you're calling it, there's treatment. There's treatment that you have to be away from work, you have to be away from your family. You walk in, you walk out, you go home to somebody called, watch TV. And go to businesses and let it work, right? Yeah. So come down to Elevate Medical, 137 Main Road, Battery, opposite Furniture Plus, right? Dr. Kwame is here, and treat yourself, right? Don't just say you're going to go away because these things doesn't go away.
Yeah, high chance, no. You might have some temporary relief, but long term, there's a lot of changes happening that you can't see or feel. And so it's important to check out.
Yeah, and one of the things I hate to see, I'll be honest with you, is people in their 40s, 50s, 60s.
Yeah,
they can't.
Walk from point A to point B. That's great.
And I think long time, Doc, what I've seen as well is that, the culture was as soon as you reach, that's 40, going down there, or going up there, you're looking for what walking stick you want to buy. Because I know I've seen that. I know time to show, but there's, the belief is still there. My knees and buy a stick. I see people walking around these around with stick in hand because they're not really dealing with the issues. You're right. They believe that, they've got two legs. And so that's not what it is, folks. You don't need that stick.
Great.
You need Elevate Medical.
Correct.
Yes?
Yeah.
Right, so this segment, again, was brought to you by I Am Water.
Yes, I Am Water.
Message in a bottle. Hidden message in a bottle. So get yours. Check out I Am Water social media, Instagram, and order yours today. So, Doc, closing statement?
Yeah, well, I just want to encourage everyone. Don't wait till it's too late. If you're contemplating seeking treatment and also getting yourself checked out, book a simple consultation. That treatment doesn't have to happen on that day. On that day, we spend an hour just chatting, setting expectations, going through everything that we could expect to give you the best chance at recovery and getting back to the life that you know and love.
Nice. So this is about Vicky Fortune's Fitness Lifestyle Magazine. See you next week for our next segment of
Health and Wellness Check-In.